If you were to become ill, what might you expect from the NHS? Good clinical care, of course, but what else can the NHS provide? What about the buildings we ask people to visit? What about the land around them? In recent years, strong evidence has emerged that links the availability of accessible green space to positive health outcomes.
Green exercise is a term that's often used when we're talking about everyday activities that can be done really in the outdoors. I'm not talking about anything extreme or high risk or anything like that, but really just gentle activities. So particularly walking, or as we've got here in this site, it can be gardening activities or other therapeutic activities in the outdoors.
Over recent years, there's been an increasing body of research which has looked at the impact of green exercise on health and well-being, and there's now compelling evidence that that improves not only our physical health, but also our emotional and mental health as well. One of the really interesting pieces of research that I came across was actually for even people who were stuck in a hospital bed, if they were able to connect with the outdoors through a kind of good view from their window, showed that actually their recovery times from operations and their use of analgesics and painkillers was very much less.
What are known as green prescriptions are already being used in the NHS, but we could be doing so much more. To really experience the benefits of green exercise, we need to bring good quality, accessible green space into every community and into the heart of the NHS.
If we can create an environment there that's therapeutic, that's consistent with the policies actually that the government have given us to work to, I think we've done a really good thing.
The aim of the Green Exercise Partnership is to improve the management of the outdoor NHS estate and to ensure that people have an opportunity to use the outdoors for health and for well-being.
Across the country, we've identified a number of sites within the mainland health board areas to really showcase examples of good practice of what can be done if we bring all the right ingredients together.
What we're hoping is to build an evidence base and a series of projects, and we hope in that way we will begin to start to shift and change attitude.
The NHS Green Space Demonstration Project is already showing how the pooling of expertise from across a number of sectors can help to create high-quality green space accessible to all. The demonstration programme has already shown how green space can be used for therapeutic work, taking healing and recovery outdoors.
We have several groups that use the garden throughout the week. These include amputee patients who are going through a process of rehabilitation, user groups such as Dundee Association for Mental Health or the Maggie Centre. We get a lot of referrals as well from occupational therapists, from medical practices and from organisations such as Employment Support.
The green space at Forth Valley is very useful for us. We use it as part of the rehabilitation programme. Stress can play a major part in a cardiac patient's life, especially as they've just been given a diagnosis of a long-term condition. And using the green space can help alleviate that by going out and getting some fresh air, communicating with other patients and just enjoying the space.
But the green space doesn't just provide benefits for patients. The NHS is one of Scotland's largest employers, and making better use of the estate can also improve the health and well-being of NHS staff.
You have various woodland walks, some can take 15 minutes, some can take half an hour. This one you could run in your lunch break. This one, if you're going to a meeting, you could walk through that. It's all about really trying to transport you and trying to take you away.
It's just fantastic because it means if I'm having a day full of meetings, I can nip out and disappear into the woodland for 10 minutes just to clear my head, sit down in one of the seats in the middle of the wood, and I could be miles away.
At Ayr and Ailsa hospitals, a further phase to the project aims to add integrated cycle tracks, encouraging active commuting. But in addition to the benefits for patients and staff, This work is also about making the outdoor NHS estate an exercise destination for local people.
Postle Park is one of the most deprived communities in Scotland, and we were really keen to invest both in terms of the new health centre but also in terms of the environment. It's quite a harsh environment, and we were really keen to kind of support the development of this community growing space here.
Across the demonstration project, collaboration between the healthcare and environment sectors has brought additional expertise into the management of the outdoor estate.
We in estates and facilities and capital planning have professional expertise, but perhaps not always in the external environment. We do grounds and gardens very well, but when it comes to that master planning, when it comes to the biodiversity, the principles that are involved, it's good to have the experts there.
In addition to the direct health benefits for patients, staff and local communities, the demonstration project is also showing how work to improve the estate can help tackle a number of issues facing the NHS. An increased understanding of the impact of external design can also result in expensive problems being avoided.
We know that the climate is changing, we know that it's getting warmer, we know that our buildings are being designed to be far more airtight, but the downside of that is the solar gain that we're experiencing and the build-up of temperatures that we're having in nigh on every new build across the NHS Scotland.
You're looking at sustainable urban drainage, you can improve the site for biodiversity and you can make it nice for people to be in.
We've now got evidence that shows for every pound that we spend on green space, we're actually realising over £4 of social and economic benefits from the wider range of sustainability gains.
To enjoy the full benefits that result from improved green space, this thinking needs to be built into future design decisions.
Forth Valley Royal Hospital was built on the former site of Royal Scottish National Hospital, so this was a brownfield site, about 150 acres in area. We redeveloped 75 acres of it. The hospital cost around £300 million to construct. In terms of the green space commitment costs, we probably spent over a period of about 5 years £500,000. So very modest compared to the overall investment in the hospital.
It's building in the green space from the very start so that it's not thought of as an add-on, an additional cost at the end.
The NHS Green Space Demonstration Project has shown what can be achieved to enhance the outdoor estate at relatively low cost. The positive impact is there for all to see. But to achieve real change, we need to apply this thinking across the healthcare sector and to encourage patients, staff and our communities to engage with these new spaces. Together, we can make places which are nurturing of positive health, well-being and resilience.
The message we would like people to take away is that we're starting to make steps in the right direction, but we need to do more.
Across Scotland we have a wonderful health facilities estate that sits right in the heart of communities, and I would like to see much more opportunity being exploited to promote those facilities for this type of purpose.
Our vision for the future is that green space is built into every investment decision, every new development, every refurbishment across NHS Scotland. For climate change, for biodiversity, but also for the health of our people.